We're going to talk about patellofemoral syndrome and what exactly it is and what you can do about it. Patellofemoral syndrome is a painful condition where people will get pain right around their kneecap. In general, it's much more common in jumping athletes and specifically younger teenage female athletes. Okay, and here's what happens. This is the mechanism, and that'll lead us to our solution. So routinely, what will people have pain with? They'll have pain jumping, running, going up and down stairs, more specifically going downstairs, or even a sit to squat in more extreme conditions. So what does patello mean? Patello means kneecap. So if we look at, we have a femur, our thigh bone, and then we have the shin bone, okay, which is called the tibia. And then on the outside we have the fibula. So this would be looking at the left knee. Okay, so thigh bone, shin bone or tibia, and then the fibula on the outside. Our kneecap is right there, so that's the patella. Okay, so patellofemoral, femur is right here. So there's a little groove at the end of the femur that patella, as somebody runs, jumps, walks, as they move around, that patella goes up and down. So as the knee bends and straightens, the patella rides up and down in a groove. What holds that in place? This is not a normal bone-on-bone joint that you would think of. It is, the kneecap is actually floating within your tendon. And that tendon, you have your quadricep, which is the 4 thick muscles on the front of the thigh. And then there's a tendon that goes down and attaches to the top of the shin bone or the top of the tibia. The kneecap floats within that. Okay? So what happens in patellofemoral syndrome is the pull will not be balanced. So you have a muscle called your VMO pulling your kneecap one way, and then you have muscles on the outside, including your vastus lateralis, which is a big fancy term for meaning the outside muscle in your quadricep, and your iliotibial band will be pulling this way. So what happens we'll go back to the example of young female athletes, is the VMO becomes weak because they're growing at a tremendous rate, and the ITB is tight. Okay, so this is really, really big, and this is weakened. Okay, so what happens is that kneecap, the patellofemoral system, the kneecap is tracking outside of the groove, and that creates friction and it creates pain. Okay, so the answer to that, and you can go to, we have a video called Top 3 Exercises for Knee Pain, and the first exercise on there is a quad set, and the quad set strengthens the VMO. Second one exercise on there is called straight leg raise, and the straight leg raise strengthens the VMO. So we're increasing this and balancing it out again. And then the other thing that should be done is the tissue out here, specifically the iliotibial band, which runs down the outside of the hip the whole way to the knee. That should be addressed. And we have a video for that as well called Top 3 Exercises for Iliotibial Band Syndrome, ITB syndrome. You can take a look at that. So when we're treating somebody with patellofemoral syndrome, we strengthen this, we stretch the iliotibial band, and then in some cases we'll actually use tape, and there's a procedure called patellofemoral taping or McConnell taping, where we use tape to bring the kneecap over and help that ride up and down in the groove. Another key secret, if exercises alone aren't working and what you're doing with your doctor is not working, you want to find the best hands-on physical therapist in your area, and you want them to screen out your pelvis. Or if you're a mother watching this for a child, you want to find the best hands-on PT in your area and have them do that on your child. There's a frequent phenomenon which is showing up in the research now in the last 2 or 3 years, where the pelvis will rotate, and if you follow this down, what attaches to the pelvis? You have your hamstrings in the back, your quadricep in the front, this big muscle right here attaches to the front of the pelvis, and if that's rotated or not moving the way that it's supposed to, it'll make this quadricep pull really, really weak. And that allows that patellofemoral condition to occur, because now the kneecap is not riding up and down in the groove like it's supposed to. So How do you find the best hands-on PT in your area? You call up to schedule an appointment and you ask, do your therapists do grade 5 lumbopelvic mobilizations? Your son or daughter might not need that. You might not need that specifically if it's your condition, but that'll help you identify a physical therapist who is familiar with all these variables and can help you control that and help you get to the point where you can run up and down stairs, or you can go up and down stairs pain-free, and you can squat and jump without symptoms. That is patellofemoral syndrome.